This video will be discussing the impact and prevalence of drugs and alcohol, effects of addiction, treatment options, and effective support for the addict. Drug and alcohol abuse has been around for centuries and has been becoming a major issue in the United States for decades. Research on addiction and drug use started becoming more prevalent in the 1970s and has continually improved since then. The abuse of alcohol, tobacco, and illicit drugs cost the United States more than $7 billion annually in costs related to crime, lost work productivity, and health care. According to the Center of Disease Control, in 2014, there were more than 25,000 deaths from overdose on prescription drugs and more than 10,000 overdose deaths from heroin. Also in 2014, the Substance Abuse and Mental Health Services Administration found that 49.2% of people ages 12 and older claim to have used illicit drugs in their lifetime, 10% in the past month. There are newer drugs that are becoming more popular and potentially more dangerous since little is known about the effects of these drugs. Some of these drugs include synthetic cathinones such as bath salts and flakka, and synthetic cannabinoids such as K2 and spice. These drugs have proven to show horrible side effects, including psychosis, paranoia, and death. Despite the information, according to University of Michigan's Institute for Social Research, the use of these drugs are still becoming more popular, especially among the younger population, most likely due to its bargain prices. Addiction is a chronic disease characterized by drug-seeking behavior and use. Although genetics plays a role in addiction, anyone can become an addict to any drug or alcohol. How? Well, most drugs affect the brain's reward circuit by flooding it with dopamine. As the person keeps using the drug, the brain adjusts to the excess dopamine by making less and/or reducing the ability of the use of cells to respond to it. This causes them to get less pleasure from the things that they used to enjoy. Now they are using the drugs not for enjoyment, but just to feel normal. As the drug use continues, more areas of the brain are altered and the memory of what happened last time they used drugs or tried to quit is gone. All the addict has now is craving. Craving for addicts is a painful emotional state where no matter what they do, they just can't stop thinking about using drugs or alcohol. It is important to remember, addicts cannot choose not to crave. Unfortunately, when it comes to addiction, treatment isn't a cure, but it can be managed just like heart disease or diabetes. Ample research has shown that a combination of medication, given an alcohol or opioid addiction, and cognitive behavioral therapy is most effective in treating addiction. Medication can help suppress the withdrawals that come from the termination of opioid and alcohol use. Medication also assists in relapse prevention by reestablishing normal brain functions and decreasing cravings. Outpatient cognitive behavioral therapy helps addicts recognize, avoid, and learn how to cope with the situations in which they are likely to use drugs. Inpatient or residential treatment can also be really effective, especially for those with more severe problems including co-occurring disorders. These treatment options include therapeutic communities where the individual remains at a sober residence for 6 to 12 months, and recovery housing which provides supervised short-term housing for patients and help them transition to an independent life. But even with effective treatment, addicts will be at risk for relapse their entire life, and that is because the craving may never go away. So what can we do to help those who we know are struggling with addiction? 2 key traits are important when supporting an addicted person: understanding and patience. First, remember, addiction is a disease, and the addict cannot simply choose to quit and immediately be successful. Also, know that relapse is probable and may be expected. A study by Dennis Foss and Scott in 2007 showed that 50 to 90% of addicts that seek treatment relapse at least once in the first 8 years. If relapse does occur, keep in mind that it is part of the difficult process of recovery. Also, don't take it personally and try not to get upset at them. They are not relapsing to spite you. They do not want to upset you or be an addict. They just want to feel normal again. Tell the addicted person about the benefits of Alcohol Anonymous and Narcotics Anonymous for community support. 74% of members say that AA was an important part of their recovery. Treatment is out there and it can really help with the recovery process. According to the Substance Abuse and Mental Health Services Administration, 22.5 million people ages 12 or older needed treatment of illicit drug or alcohol use in 2014. Of those people, only 4.2 million, that's only 18%, received any treatment in that same year. Drug and alcohol addiction recovery can be dangerous, especially opioid and alcohol withdrawal. Don't do it alone. Help is out there. There is a hope for a better, more productive, and fulfilling life without drugs or alcohol. Don't let your friends or family become a prisoner to addiction. Give them the support they need to recover.